registered could not be here today, and so that's the reason as to why we're recording, but we're so happy to have you all, and let's get started. My name is Daisy Beloya Sotelo. I use pronoun she, ella, and I'm the advocacy and policy strategist here at OHE, and you are at, or where are they now, Evan? Yeah, legislative Evan. I'm so excited to welcome you all today. And of course, we have some bills to talk about, and I'm really excited to have some panelists who are joining us today to talk about them. Here's what our agenda looks like. I will be talking a little bit about who OHE is for those who are new to OHE. Welcome. And we will also have a brief introduction of our panelists, then we'll dive right into presentations. And at the end, we will have questions and answers. And one of our panelists does have to leave a little early, so we will pause and answer some questions for that presentation, which will be our first presentation. But if we don't have time to answer all your questions, which I'm sure you all probably have a lot of questions, please feel free to put them in the chat and we can reach out to you all as well. I know that this is a small presentation, so we probably won't go into depth, but I'm sure that folks here will be more than willing to share their contact info with you all. All right, before we get started though, we have to do, of course, our Zoom tutorial and overview. So hopefully you all can find all the windows and everything that you need to be active today. But before we move, I do want to say that we have Spanish interpretation, and in your screen, this is what it looks like, a little globe. So if you need Spanish interpretation, please make sure you click that channel. And thank you for our Spanish interpreters. And also a plug for our presenters, please slow down because there is Spanish interpretation. So we want to make sure that we are aware of that. And another thing, just if you want to change to gallery view so you can see all of our beautiful faces and presenter faces, please do so. Otherwise, you can pick the other view that the view that you feel more comfortable with. And another thing, just there's our Q&A, so you can drop your questions in there. And we will also be answering those live. Also, feel free to raise your hand. Though, like I said, questions will be at the end for the 3 presentations, but otherwise you can also drop them in the chat, which is right here, as you can see. And you can also see the participants that are here today with you all. Right, before we get started though, with our presentation, I do want to do a land acknowledgement, and our land acknowledgement here at OHE reads as follows. Every community owes its existence and strength to generations of ancestors who contributed to our hopes, dreams, and collective possibilities. Together, their history allows us to live our own legacy of hope and justice. Our collective history is that of cultural resilience, re-indigenation, adaptability, colonization, settlement, systemic violence, racism, and forced displacement. Acknowledging this truth helps build mutual respect and connections across diverse communities and lived experiences. But who is OHE? Who are we? OHE is a people of color-led collaborative organized to center and uplift the wisdom of communities of color through racial justice, inform health equity policies and practices as part of the movement to dismantle white supremacy and shift the imbalance of power. In our vision, we really envision a world where people of color are able to live fulfilling and healthy lives, however they choose. And our bodies of work are advocacy, convener, and knowledge center, but those will be changing soon because we just went under strategic planning. So be in the lookout to see how our bodies of work will change in the future. But we're going to get started with introductions. And at this time, I'm going to ask all of our panelists if you can turn your cameras on and please just share your name, your pronouns, the organization that you're representing today or who you're with, and as well as what bill you'll be talking. So I'm going to hand it over. The first person that I saw pop was Samantha. So I'll hand it over to you, Samantha.
Hello, everyone. My name is Samantha, and I use she, her pronouns, and I'm with the Oregon Physicians for Social Responsibility. Super excited to be here with you all today.
Thank you, Samantha. We'll hand it over to Andrea.
Hi everyone, my name is Andrea Vanessa Castillo. I use she, her pronouns, and I am with the Oregon Latino Health Coalition, or OLHC, and I'm here with my colleague Laura, who will introduce her in a minute, to talk about the Healthier Oregon program.
Go ahead, Laura.
Yes, I am Laura, and thank you, Andrea, for that. I'm also with Oregon Latino Health Coalition. My pronouns are she, her, ella, and also here to talk about the Healthier Oregon program.
Thank you, Laura. All right, let's kick it over to Mika.
Hey, good morning, everyone. My name is Mika Contreras. My pronouns are she, her, with the Lynn Benton Lincoln Health Equity Alliance, and I'm here today to talk about the Regional Health Equity Coalition bill.
Thank you, Mika. All right, and we'll kick it over to Devin.
Hi, everyone. This is Devin Downey Smith, she, her, Aya. I'm with the Health Justice Recovery Alliance, and we're an organization that has worked to advocate for Measure 110 implementation and to defend the services being funded by 110. And I'm going to go ahead and stay camera off because I'm having some remodeling stuff in the background, but you can just see that picture of me in Portugal and know that that's what I look like all the time, effortlessly, without any glam or makeup.
Thank you. Thank you, everybody, for those introductions. We're going to jump right in, actually, and we're going to get started with Devin. So I'll hand it over to you, Devin.
Thank you. So I just wanted to come and sort of give a brief overview of Measure 110 and House Bill 4002, which made some significant changes to Measure 110 last session. And I just kind of want to start off saying that I am our communications person. I'm filling in for our policy expert. So if there's anything that you want to know today that's really specific to the policy, I'm also going to be linking to a policy specific presentation we did. So if you really want to get in the weeds, that's like a 45-minute Zoom all on House Bill 4002 and what it does. And it's really looking at it from the lens of how it impacts addiction recovery providers and the people they serve, which are primarily communities of color who've been most impacted by drug war policies. Okay, next slide. So to just kind of set some context, there's been so much in the news about what, people reporting what Measure 110 is. So like just keeping it really grounded in the law and what it is. It was passed by Oregon voters at the ballot in 2020. It passed overwhelmingly with 58% support. The law decriminalized, which is different than legalizing possession of small amounts of drugs. So basically, the difference between decrim and legalize is, it's not permitted as a legal activity, but if you're caught with small amounts of drugs, you would receive something similar to a ticket, like a traffic ticket or a fine, rather than a criminal charge, even though that charge was just a misdemeanor. So the law also directs marijuana tax revenue in excess of $90 million per biennium to go toward funding harm reduction and addiction recovery services that are across the continuum of care. So that could be everything from like one of the things that makes what Measure 110 really great is how flexible the funding mechanism is. So I've heard grantees say things like, Centro Latino Americano in Lane County, they were able to buy bike helmets and car seats so that their clients who are trying to get to treatment can do so like while bringing their babies with them safely, or like if they're riding their bike, then they have a helmet. Just little things like that that are so important to quality of life and health, but that are not typically covered by someone's program when they're in an addiction recovery service. But I digress. The law also required that savings from the criminal, which we call it the criminal legal system, not the criminal justice system, because it's not it's not that yet to us. But it required that savings essentially from not prosecuting people for these low-level drug crimes be calculated and allocated to the Drug Treatment and Recovery Services Fund, which is just like the name of the fund that holds all the pot of money that gets to these grantees. So it was like an extra $40 million of law enforcement savings got invested. So as far as other money went out, it was $302 million that went out in the grant years between 2021 and 2025. And then the 40 million in law enforcement savings. And then there is $200 million in cannabis tax revenue that's been invested for the 2023-25 biennium. And there's been lots of reasons why Measure 110 has not been implemented well and why it has not lived up to the dream of what all of us hoped and wanted it to be. I could spend an entire presentation talking about all the different elements of why, but I'll just keep it simple for now and say that the citation and hotline processes were never fully implemented as intended. And we had just issues everywhere from, fentanyl flooding the market to houselessness increasing, just a lot of really big things that added to the suffering we're seeing on our streets that had nothing to do with Measure 110, but there was a big perception that there was having to do with 110. So that's how we got HB 4002. If you want to switch slides, and I will talk about that, but I really want to emphasize the services part of the law before I talk about 4002, because even though 4002 did reinstate criminal penalties, the services part of the law is still intact. And these services are incredibly important and they're saving lives. And this is what our advocacy organization is going to be working really hard to defend in the 2025 session, is ensuring that these funds keep going where they're going, which is to primarily small community organizations that are serving these communities most harmed by the war on drugs. And this program has enabled them to scale up in ways that they never have before. Like, for example, the Miracles Club, which serves everyone but has a focus on serving the African American community, they went from a staff of 3 to 30. That's huge. That's just so that's 30 direct service staff, and then each of the 10 to 15 people, those people can now take on to their caseloads because they have more support. So the real spirit of Measure 110 was to really try and create a system that treats people who use drugs through a healthcare lens and not through the criminal system. And so that's why it's all about expanding access to low barrier services. And that includes everything from harm reduction and survival supplies to treatment. And treatment is everything from inpatient to intensive outpatient with housing, sobering, detox, peer-supported recovery services, supported employment. Like, it really funds everything across the spectrum. Okay, next slide. Just to give you an example, so this is Oregon Change Clinic, and Measure 110 allowed it to go from the dilapidated motel that you see on the left to this culturally specific housing for African American individuals that are enrolled in their 6-month intensive outpatient treatment program. And this housing was identified as a need because people were going through their program, but then they were houseless. And so they would, like, how can you work on your sobriety and stability and anything if you don't even know where you're going to sleep at night and be safe? So Measure 110 enabled them to house people in their program, and now they're seeing this tremendous success rate. And yeah, it's just, I just feel like it's such a visual showing. Okay, next slide. And so just to show data real quick. So the latest data shows that these services are really working and they're really getting out. So more than 220,000 encounters for treatment have happened in the 15 months that we're OHA is really behind on reporting data, but the most recent data available, that's what it shows. SUD screenings are up 346%, which tells us that providers are seeing more new clients. Peer services are up, which is an essential service for long-term recovery, and supportive employment is up. So that's just some fun data. And this picture is of the ribbon cutting of a detox center in Portland off Foster Road that's fully funded by Measure 110, 16 beds, 1,200 people serving a year, primarily focusing on fentanyl withdrawal and detox. Next slide. And so 4002, like I said, I got a whole policy presentation if you want to wonk out on it. But the basics as far as how it changes 110, it reinstated criminal penalties for low-level possession. And they didn't take it back to whatever misdemeanor it was before. They created a new misdemeanor. The consequences for that can result in up to 180 days in jail and or up to 18 months of supervised probation. The lawmakers wrote the program in such a way to say that law enforcement is encouraged to refer people to deflection rather than jail. And deflection is some way that that law enforcement and outreach workers or behavioral health entities collaborate to basically keep people who have these issues or who have committed crimes based on mental health or based on addiction or based on being in despair, that we can like deflect them out of the system and actually help get them help. And if they complete deflection, they should incur no fines, fees, or costs. And what's this going to look like? How are they going to do this? We don't know. That's part of the problem. Lawmakers passed something. We don't know what's going to happen with it. But we do know that there are some real life examples of where deflection is working well, like Cahoots. And there's a provider project in Portland that we've been a part of where we've connected over 150 people with services same day, including detox. And that's been in partnership with the police. So I tried to go fast because I know this was more slides than others, hopefully not too fast for the translators. And I'm happy to answer any questions that you have or try to.
Definitely. Thank you so much, Devin. And I also want to say that we will be having other conversations about this topic. As OHEI, this is just, a small snippet of what is happening and what has happened for this specific measure. But does anybody have any questions? I'm sure probably folks have a lot. So if you want to raise your hand or drop them in the chat now that we have Devin here to see if we can answer some of those questions. And I will stop a second. I know it was quick information, definitely. And I will also be sharing the recording with you all. And I know Devin said that there's a webinar, right, Devin?
Yeah, let me put the link to that in the chat and I will email it to you as well if you want to like send it as follow-up. But yeah, this is one of those videos that like it's not a public link, but if you have the link, you can see it. So share it with anyone who you think would want to know. We just didn't, want to send it to like Fox News.
Yeah, definitely. I see a question in the chat and it says, is there any statewide monitoring of implementation of the new county deflection programs that you know of?
No, and that's part of the problem. There are some counties that are taking it on, and you can see in counties like Deschutes, for example, that they already kind of had their own good deflection program going, or one that was working better there in other parts of the state. So they're kind of leaning into that to create, but only 23 of the 36 counties have even agreed to do this. And that's part of kind of the red flag that we're raising is you guys are saying you're going to do this and how. So we're we're really working with our partners to try and make sure that someone is going to be able to watchdog this. We know public defenders are already all over it because they're like, hey, we can't handle the cases we have now, much less like, why would we prosecute someone for a small amount of drugs when we're having to sometimes let, violent murderers go. So I know that's not a very reassuring answer, Michelle, but I will tell you that there are a lot of people who realize how much there is not a sufficient plan and are really pushing to be like, hey, if you're going to do this, like, we can't just say September 1st is here and now everything's better. So we are pushing them. Okay, the same level of funding. So for the question about 4,000 to not affecting the services part, so it does protect the same level of funding, but not the police savings, because there won't be police savings if they've reinstated it as a crime. And that we're also working really hard to get like a new RFP for the grantees out quickly, because we know that if this money is still kind of sitting there in the 2025 session, there's going to be lots of power grabs for it. But if it's already dedicated and allocated, then it'll be safer. And we've got providers across the state. You know, I get at least one call every day that's like, hey, do you think I'm going to be able to make payroll in 6 months? Like, how long is this going to last? And like that kind of insecurity is just not acceptable for anyone, but especially in my opinion, for frontline providers who are trying to just help people, you know, in any way they can. Does the state have any data about how much was diverted to police savings in the first year of implementation before it was overturned? Well, so the only thing we know is the $40 million. And I can get the exact time frame on you for that, but last May, when the revenue office presented before the, you know, whatever legislative committee it is that does all the money stuff, they mentioned like as part of the revenue forecast for the entire state, and here's $40 million savings. And even though we'd been working on this, that was literally news to us because no one had said anything. So there is mystery around things, and we're just doing all we can to like just keep it in the limelight so that they feel like they've got to really implement this well and do this well. And they're luckily providers are doing so many amazing things that it's not hard to highlight, you know?
Devin, what can you share with us? I don't know if it's too early to say, but in terms of what could we potentially expect to see? I know you touched a little bit about it, but next legislative session?
So yeah, there's a lot of unknowns right now, and I think we'll know more after the primary election. Like I think that just kind of helps set the political stage. But what we are anticipating in the next session is, you know, counties and cities got marijuana tax revenue before this, and some of them are really not happy that they didn't get it, and so that it's taken away through this new formula, or that they get less. And so we could potentially see cities and counties coming together to really advocate to get their money back, which, you know, isn't a terrible thing, and that they'll also be using it to fund certain services and to make communities stronger and all that. But that's not what the voters voted for. They voted for expansion of treatment services. And as someone who's been working on this issue since funding finally got out, like it's only just now in 2024 that we're seeing like people who, you know, they've hired the people, they've got them trained, they've got the capital. Now the house is opening. Now the recovery house is opening. Like now the detox center is opening. So unfortunately, 4002 was like a big political decision made without really considering the full ramifications. But I think everybody felt the pressure and was like, we've got to be doing something. And you know, just, I mean, I am working on this, but like, this is also my personal interpretation, just having worked on it. So I guess there is like some knowledge there, but if you disagree, like, I'm just a person and this is my take on it, you know? Tell us more about who is working on getting a statewide plan and how community members may support this effort. So we are working on it, and we are working with other organizations and community partners to push for it. And so I think we'll know more after the primary. What would be really great is if anyone wanted to sign up for our newsletter, which I'll put a link to sign up in the chat, and that is how we'll let you know about action alerts and opportunities to get involved. And a lot of it is honestly like legislative communication. So, you know, making sure your lawmaker, like, you know, I could help you find out who some of the grantees are in your area and the work that they're doing. And then if you just wanted to like take what I send you and put it in an email, like, hey, I'm your constituent. This great work is happening in our community, and I just want you to know I support it and I hope you'll continue funding it. Like, we're going to be doing a lot of stuff like that over the next year, a lot of show and tell with data and stories about families being reunited, about parents not having to go to court hearings alone, not having to go to treatment alone. Like, there are just so many hopeful stories, and we have to get them out there because the media just wants to show really stigmatizing imagery of people struggling and kind of only tell the most salacious version of it. And so we can't count on them for that. So yeah.
Definitely. Thank you, Devin. Well, if you all have any other questions, feel free to put them in the chat, and we can always refer them to Devin and circle back with you all. But that was a lot of good information and important information that I think our community needs to know. So thank you so much for being here, Devin. We appreciate you.
Yeah, thank you for having me. There's a link to sign up for our newsletter. And I'll also put my email in the chat, and really feel free to just reach out to me anytime. I'm happy to help.
Perfect. Thank you. Thank you so
Thank
much. All right, we're going to transition now into the rec bills. So that is Mika, and let me share my screen with you all so that you can see the beautiful presentation for that. But if there's any other questions or anything, feel free to put them in the chat. And for these next three next presentations, we will have the Q&A at the end. So feel free to just put them in the chat and we will come back to them. All right, Mika, I'll hand it over to you.
Thanks so much, Daisy, and thanks, Devin. So I'm Mika, and I'm with Lynn Benton Lincoln Health Equity Alliance. We can go to the next slide already. And today I'm talking about the Regional Health Equity Coalition bill. And to give a little context, we'll just start by grounding ourselves in what regional health equity coalitions are. And so regional health equity coalitions are grassroots community members. We come together, form a coalition, and we are really the driving force behind identifying the issues that are impacting health equity in our region for our priority communities. And we work to create solutions, long-term solutions through policy and systems change. And health equity really is just, the opportunity for everyone to be able to reach their best health, regardless of any socially determined circumstances or social conditions, such as race, ethnicity, language, disability, gender identity, sexual orientation, income, neighborhood, or any other thing that's socially determined. And our priority communities are communities of color, tribal communities, immigrants and refugees, migrant and seasonal farm workers, low-income folks, people with disabilities, and Two-Spirit LGBTQ+. And I should add that, in addition to this, the coalitions actually also work really hard to ensure that, racism and other forms of inequity don't permeate or infiltrate new policies that are coming in the area. So, we work on a variety of scales, not only addressing those historic injustices, but making sure that within new policies that we make sure that they're the most equitable as possible. Next slide, please. And currently we have 9 regional health equity coalitions that represent 20 counties as shown by this map. So you can see that there is a large portion of the state that unfortunately doesn't have the benefit of having a regional health equity coalition. On the right hand side, you can see the different counties and the different recs that are currently in operation, and mine is Lynn Benton Health, and you can see OHE also here. If you could do the next slide, please. And so why do we need a bill, or why do we need to fully fund and expand regional health equity coalitions? Well, there's a lot of reasons. First, our funding hasn't changed since 2014, which just even saying out loud, I'm sure sounds absurd to you. And it's definitely absurd to folks who are working, within the regional health equity coalitions, because things have changed so drastically, not only in terms of need, but also in terms of just basic costs, right? So the cost of doing the things that we need to do has changed drastically. Additionally, the grants that were allocated for us, they were originally intended to support 1 full-time staff, but each regional health equity coalition covers at least 2 counties, and that's just not sufficient. And additionally, we know that we don't have statewide representation And so we need to be able to correct that, because there are folks, you know, that would really, there are already folks that are forming coalitions that want the Regional Health Equity Coalition, that are already doing the work, and they should definitely be afforded the chance to have that possibility. So if on the right-hand side of my slide, you can see that these are it's kind of like the history, the timeline of what has happened. So in 2023, our ask came through SB 564, which was a Senate bill introduced by Senator Gelster-Bluen. And the bill passed through committee, but unfortunately it stalled in Ways and Means. And it was a wild session with walkouts and a lot of unexpected happenings. So it didn't pass. And then in the short session of this year, we actually had the ask come from the Oregon Health Authority. And we also had the support of the governor's office, but unfortunately it didn't find a vehicle for passage. And so we're still left with the same funding. And so upcoming, what's coming next? 2025, we have a new bill that's going to be introduced by Senator Patterson, who's the chair of the Senate Healthcare Committee. Next slide, please. And the impacts of the bill, we're gonna just ignore the number, the dollar sign in there, because actually we don't know what the exact number would be. That's still to be determined. But the impacts on a broad and more general level would include 5 new regional health equity coalitions, which would be very exciting. We would have a lot more coverage around the state. That would include 4 staff for OHA, but then we also would have 2 additional full-time staff per coalition. Really, that would increase our capacity astronomically, as well as we would have fully supported programmatic costs, and we would finally correct that pesky thing that has been, you know, daunting us, which is not having inflation built into our budgets, right? We need to be able to ensure that our budgets are actually appropriately allocated for the time and including inflation. So that is the ask, and we're hoping that it goes through. And I think that was my last slide, and I'm happy to take any questions.
Yeah, definitely. Let's take a second and see if folks have any questions. You all are right on time and making this very easy for all of us to grasp all the information. So thank you, Mika. But I will wait and see if folks have questions. Feel free to also raise your hand. And that way I can call on you, or just drop them in the chat, but I will wait a second, or we will wait a second to see. I wonder if we can take, I know there was a question early, Mika, that was asked in terms of what could other organizations potentially do to support, or just across the state. Would you mind just sharing? Yeah, what can other organizations or community members do to support this bill?
Again, that's a great question. And I think that we will have some more clarity going forward in terms of how specific organizations can endorse the bill once it comes out. We'll have ways that you can communicate that, as well as community members. But again, I think, you know, as we heard earlier, really the most important thing to do is, you know, communication with your legislator, right? Just make them aware that maybe there's a rec in your area that you're already active with, or maybe you're in an area that would really benefit from the resources and the efforts of a regional health equity coalition. But to be able to convey that and make them understand why it's important, and why equity really matters, and why we have to have these organizations to ensure that you know, we are addressing these historic injustices, right? And making sure that they don't come into our policies as we move forward. So I would say that, and then of course, check to see if there's a Regional Health Equity Coalition in your area, and you can get involved with them. And you can always, of course, get on our newsletter, and we will be providing more information as it becomes available on how to get more involved.
Thank you, Mika. That is helpful. All right. Any other questions? And also feel free, Mika, to drop your information in the chat so that, well, if that's okay with you, folks have questions, they can reach out to you. And we will also be sharing all of this information, links and emails via email, of course, after the event, so that way you'll have access and can hopefully get involved with all these amazing things that are happening. Thank you, Mika. All right, I will wait just one more sec just to see if there's other questions, but also if other questions come up as presenters are going through, feel free to drop them in the chat. We can always ask them and bring them back, definitely. Shout outs to Mika in the chat. Yes. Thank you, Mika. All right. Well, what we're going to do today, right now is actually transition into a break. I know we've had already 2 presentations, and we are going to just take a 5-minute break and then come back. So make sure you stretch, get some water, and then hopefully also do some thinking, right, about these bills, and then we will be back to talk more about early compassionate medical release and healthier Oregon as well. So we will be back. I think the clock is going to turn any minute at 10:44. So we will be back at 10:49 to reconvene. So take a 5-minute break and we'll be back at 10:49. Thank you. We're going to continue with our presentations, and I'm going to ask Samantha to join us. Hello. What's this? There we go. All right, Samantha, I'll hand it over to you.
Thank you. Hello, everyone. Again, my name is Samantha Hernandez, and I use she, her pronouns. I'm the Healthy Climate Program Director with Oregon Physicians for Social Responsibility. And we are an organization of over 2,000 health professionals and public health advocates working to protect human life from the greatest threats to survival. And today, the Oregon Health Equity Alliance, OHE, invited me to talk about the Early Compassionate Medical Release Bill. And for a little bit of background, I'm sure some of you all are wondering, what is compassionate release? And so compassionate release offers an opportunity for terminally ill or severely sick individuals to be released early from prison in order to access adequate care. And so this bill is something that numerous organizations have been working on. The Oregon Justice Resource Center, my organization, Oregon PSR, OHE, Families Against Mandatory Minimums, and other partners and organizations, the ACLU as well. We've all been working together to actually pass a law that reforms Oregon's current early compassionate medical release process, which is honestly currently very ineffective and inaccessible. Just for reference, only 9 adults in custody were released between 2013 and 2020, while 11 adults in custody actually passed away awaiting decision during that same time period. The average wait for the 9 successful applicants that were released was 167 days. In addition to these lengthy delays and this lengthy time, it is often really difficult for families of adults in custody to spend precious remaining time with their loved ones. Also, the current process, the eligibility criteria is just really narrow and not available to most adults in custody. The application process is unclear and inaccessible to most adults in custody and their loved ones. And review of requests is actually not done by health professionals. And as previously mentioned, can take a significant amount of time to complete and process. And so this legislative session, our group of organizations, we worked alongside Senator Dembro to introduce Senate Bill 1560, SB 1560. And this bill proposed to create a task force to research and analyze the pitfalls of Oregon's current compassionate release process. And this bill would have led the way to more effective policy that places decisions about early compassionate release in the hands of medical professionals who have that health expertise. And it also would have established much needed support and resources to adults in custody during the application process and post early compassionate release as well. This bill concept also has many monetary benefits as well. The Oregon Department of Corrections, the ODC, has acknowledged that a small number of individuals with serious medical needs take up a significant portion of its health services budget. And compassionate medical release reform is actually predicted to result in multi-million-dollar savings to be invested in things such as rehabilitation, reentry programming, and improved medical care. And I want to read a quote really quickly from one of our members, Theodora Songis. She's a environmental health scientist, an epidemiologist who is with my organization, Oregon PSR. Theodora actually got the opportunity to participate in a visit to the Oregon State Penitentiary to observe its infirmary and hospice program. And this is what she had to say. We toured areas of the prison where people with physical disabilities are housed. We saw one of 2 rows of 40 cells, each of which had a wheelchair or walker parked outside the cell door. With their assistance devices outside of their cells, there was no way that these individuals could be assisted getting into bed, to the toilet, or cell door. I was dismayed by what I saw and heard. The bare bones atmosphere of the infirmary, the peeling paint, the inability of patients to be isolated from noise in a large and echoing room, and the conspicuous lack of staffing were alarming. Oregon's prisons are not able to provide adequate end-of-life care or care for those that cannot look after themselves. Despite the best efforts of staff and the volunteer efforts of other adults in custody, prison will never be an appropriate environment for someone who is seriously or terminally ill. And in addition to this, some good context to provide is that Oregon actually has the 4th largest aging prison population in the country. This was back in 2015. And obviously we're in 2024 and that population has grown as adults in custody serve lengthy sentences. Additionally, constant stress, poor nutrition, and the overall environment of prison life physiologically age incarcerated people faster than those outside, significantly increasing their risk of cancers, cardiovascular, and respiratory diseases, to mention, and more life-threatening diseases and viruses and sicknesses. For adults in custody and hospice care during their end-of-life stage, they are bedridden, seldom awake or lucid, and face many barriers in receiving family and friend visitation. And so unfortunately, SB 1560 did not pass this legislative session, but there's some good news, and that's that Senator Przanski agreed to lead an early compassionate medical release work group and plans to introduce the bill at the next legislative session. And this bill will most likely entail establishing what we're calling an MRAC, a medical release advisory committee, which would be a committee of 5 to 13 licensed medical professionals appointed by the governor to review applications and make recommendations solely from a medical and public health perspective. And in addition to this, a release navigator would also assist adults in custody with planning for reentry and ensuring continuity of care in the community. So yeah, we're hoping that next session, this bill will be introduced and passed, and we can finally start working on reforming the early compassionate medical release process. It's something that we've been working on for many years, and we are not giving up. So yeah, that's all I had to say. I don't know if folks have any questions, or we're saving that for later on.
We actually do have time, Samantha, for some questions. So while we wait for folks to type them in the chat or raise their hand, and tech team, if you can help me if anybody raises their hand, as I can't see anybody at the moment. But same question as we asked the other two presenters: what can organizations or community members do to support this bill?
Yeah, so we are actually holding bi-weekly meetings starting, I think, in the end of summer. So if organizations are interested in being a part of the organizing to help pass this bill, you can reach out to me. I'll put my email in the chat. And we're always looking to grow our coalition of folks. And if folks don't have capacity to be joining bi-weekly meetings, we can always share with you testimony guides, so that organizations can, write their own testimony, and also share like graphics that folks can post on their social media about the bill and how to testify, and ways to get involved.
That is helpful to hear. Thank you, Samantha. All right, let's see. Are there any questions to Samantha? And if you all don't have any, don't worry, you can put them in the chat. We will come back at the end, definitely, and ask questions if you all have them. But all right, well, sounds like not seeing or hearing any. So we'll wait until the end, but if you do have any, please feel free to drop them in the chat. And we are going to transition yet again to our last presentation, last but not least. And I'll hand over the mic over to Andrea and Laura to lead us through Healthier Oregon. We're all very excited to hear where this bill has been or where it's at. And I'll hand it over to you all.
Great, thank you so much. Let me share this presentation really quick. Okay, present here, and here we go. All right, everyone. Hello, hello. We are representing the Oregon Latino Health Coalition, or OLHC for short. And we're so excited to be here with you today to go over the Healthier Oregon program and Cover All People campaign. So as mentioned before, my name is Andrea Vanessa Castillo. I use she, her pronouns, and I'm the Policy and Advocacy Manager here with my colleague.
Yes, and I'm Laura, pronouns are she, her, and I'm the lead community health worker for the organization. And we're really excited to be here. So go ahead and hit the next slide.
Thank you. While I start off with a brief overview of the organization, I would really like to know who's in the room today. So if you could add into the chat box, if you're here as a community member who's interested in kind of public health policy, if you're here working within a public health, centered organization, if you're here for work, like I want to know, just let me know. I want to get a good feel for folks that are here as I'm going through this presentation, because I'll circle back to it towards the end of the presentation. But we're going to start off here with kind of an overview of the organization, give you a little bit of a run through of some history of the policy, and then get some insight into what the program looks like on the ground from an OHP assister perspective, and to talk a little bit about what we're working towards for our next advocacy efforts during the 2025 legislative session. So about us. The Oregon Latino Health Coalition is a 501c3 nonprofit, right? And we are an organization that's been around for 20 years. It's actually our 20-year anniversary, just putting it out there. And our mission is to advance the health of Latina community members through policy, advocacy, and prevention efforts. So what does that mean exactly, right? Our team of 10 works through our emergency preparedness, tobacco, mental and behavioral health programs to raise awareness through workshops, charlas, and focus groups, tabling at community fairs, and to push forward policy in an effort to eliminate health disparities. And one of those policy efforts is what we're here to talk about today, and that's the Healthier Oregon program. So we're going to start off talking about 2021, but that's really not to say that this is where the initiative began. Another day we can talk about how in 2009, the Healthcare for All Children Act was pushed forth, and it was healthcare coverage for all children legally living in Oregon. Fast forward to 2017, we were actually part of the push for healthcare coverage to reach all children regardless of immigration status, which ended up being successful and put into effect a year after. So zooming forward a little bit more to February of 2021, we are going to talk about how, Health Bill 3352 was put in place by Senator Campos, or was introduced by Senator Campos, and expanded the Oregon Health Plan benefits to all Oregonians who met the income and eligibility requirements, regardless of immigration status. And over the following months, we worked with over 30 partners and community organizations, including OHE, to support the bill's passing and develop an implementation plan, right? Which emphasized the expansion of Cover All people to all ages. We did an event where Governor Kate Brown was a guest speaker at our virtual advocacy day, which had over 50 community members in attendance. And it was a huge push, huge community effort to be able to say that once legislative session passed in 2021, once we were through with it, we get to the month of June, where Cover All people was signed into law with an initial budget of $100 million. This included the Community-Based Partnership Program, or CPOP for short. We have a lot of acronyms here, so stay with me. So CPOP was created to oversee the $10 million grant that our team secured, which supported the direct implementation plan of OHP assisters like Laura, who helped to really implement the plan and was renamed Healthier Oregon, or HOP, later in the year. So now, setting the stage, we're in 2022, right? Cover All People is now Healthier Oregon program, making Oregon the third state in the nation to expand coverage to all people regardless of immigration status. And with the grant money being distributed to 18 agencies and community-based organizations like us, we got to work providing culturally specific support to folks navigating the healthcare system. And to kick off the program, right, an advisory group was formed to recommend which group of people we would begin open enrollment for, right? And ultimately landed on two specific age groups, 19 to 25 and 55 and over. So after a year of implementing this plan with the two age groups, OHP assisters, began providing insurance application support, finding interpretation services at hospitals, and just overall navigation support for the healthcare system here in Oregon. And I'm not going to talk too much about that, though. Laura will give you a little bit more insight into what that on the ground work looks like after we finish through the timeline. And for now, I'll pass the mic over to her to give us more of an update on what's been going on over the last year.
Yes, thank you, Andrea. So in June of 2023, this is when the Healthier Oregon program expanded to everyone regardless of immigration status or age. And this was really exciting. Our entire team was super excited from like day to night. We literally saw on these portals, it changed from emergency Medicaid to full benefits. And families were really excited about this because for the first time they were getting full medical coverage. And these are people like new arrivals, new immigrants that are coming to the state. So it was super exciting. And as you can see on this timeline, the budget for Healthier Oregon was set at 400 million, which was really exciting to see as well because we went up from 100 million to 400 million. However, the CPOP Healthier Oregon program community grant was cut from 10 million to 4.2 million. And this was really unfortunate to see, and it impacted a lot of the organizations that were part of that grant, and this affected us as well. In September of 2023, this is when the RJC Health Equity Committee was activated to advocate for more funding to that HOP community grant program. And then this past legislative session is when the governor's office and OHA leadership requested the transfer of funds to the Ways and Means Committee in order to restore some of that funding to the HOP community grant funds. However, we heard in March of 2024 that these funds were not passed, or this request was not passed in the Ways and Means Committee. And then OHA is looking into other options for funding as of now. And on this next page, we have a couple of pictures from our team. Flor and I are the community health workers who are helping with OHP applications directly, and we help with bilingual outreach, enrollment, and navigation. It's really exciting to get to help members one-on-one, advocating for them, whether that's with like interpretation or they need certain services. We're there for them. And HOP has allowed, again, many to have health insurance for the first time. And we've also collaborated a ton with the coordinated care organizations in the Tri-County area with member education. And this looks like popular education methods just to educate the Latina community. And it's really fun to get the members involved and be partners in their own health. And then the last piece in terms of our experience, we've connected with around 10 plus CBOs or partners where we kind of have a referral system going and we get to help a lot of their members that they're reaching out to in their networks. And then some of the challenges that we've faced, some of the families we're starting to see are losing their OHP coverage, unfortunately, for being even a little bit over income. And because a lot of these families don't have a qualifying immigration status, they are kind of left, uninsured. And this is a huge issue that we're seeing. Some of the other challenges that we're seeing as well are language access and quality of these services. It's one thing for these CCOs to provide interpretation, but it's the quality of that, right, that sometimes fails. And so this is something that we're seeing as well. And then another thing that I wanted to mention was the OHP Bridge program. This is starting in July of 2024, and this is basically expanding those income limits to Oregonians. And so more Oregonians will be qualifying for OHP as of July, but this directly excluded Healthier Oregon members, which is a huge issue. And then the last piece that I wanted to touch on was just emphasizing that more funding is needed to continue assisting these HOP members and providing these culturally specific services to them, because it's really important. Yeah, I guess that's a little bit of kind of what I was going to mention on this slide. So I'll hand it back over to Andrea.
Thank you. Yeah, and on that note of more funding, we are working to strategize again to bring together state agencies, healthcare institutions, community organizations, and community members to really advocate for more sustainable funding on this work. Like the rest of the incredible organizations that we're hearing from today, we are working to reduce health equity barriers across the state, and there's always work to be done to keep the momentum going. And so thank you all to those of you who put your, where you're working at inside of the chat. I appreciate you. I see you. And we really need folks like you. We need the community members that you serve. We need people who work within your spaces to know what's going on, to be able to continue engaging with us, to ask questions, which we're happy to answer some of those here in a bit. But it is the work of all of us to be able to get to know how can we show up for each other, with each other and by each other, to be able to really advocate for, at least in this particular instance, we're working for bicultural, bilingual services, and to be able to reach more folks within Oregon, right? So just want to be able to advocate for staying engaged with us, reach out to us. We have our emails up here. We'll include them in the chat. If you're not already following us on Instagram, then scan the QR code. Follow us on Instagram, Facebook, and LinkedIn for more information. We're continually sharing updates for the HOP program, and to be able to share more information regarding public health and things like that. So I actually have a question for you all as you're thinking of brainstorming questions, but I would really love to know kind of what do you and or the communities that you serve need and are looking for as we're approaching legislative session, as we're having conversations about advocacy, as we're keeping in mind our next steps. We want to be able to think about what is the community looking for, what would be helpful as we're sharing information like this and recruiting and gathering momentum for our legislative efforts. So feel free to put those answers in the chat, email me and things like that, and we can continue the conversation. So thank you all so much for having us here today. That's our presentation for you. And thank you so much to OHE for inviting us to present today.
Thank you so much, Andrea and Laura, for this presentation and the update of what has been happening with Healthier Oregon. I do see a question in the chat that says, do OHP members have access to culturally specific mental health care as well as physical health care?
I can speak a little bit on this. So we connect, well, Healthier Oregon members have the full OHP benefits. So they have a medical plan, a mental health plan, and a dental plan. And with the mental health services, I believe it's Care Oregon who manages all of those, but they do have, there's very limited options as to, which providers are provide culturally specific services. And so that is another issue that we're starting to see. But I know we also, Andrea talked a little bit about kind of LHC and the work with that collaborative, but with OHP, there's a few providers that provide these culturally specific services, and we'd like to see that progress, of course, but limited.
Yeah, and to what Laura said, it's cool to see that some of our other coworkers are in the room with us today. So we have Migdalia, Melissa, and Olivia also in participating in this event, and each one of them kind of works. Olivia is our ED, Migdalia working with the Latino Emotional Health Collaborative, and Melissa working in our tobacco advocacy program. Each one works to be able to raise awareness and to be able to share specifically through LEHC, our Latino Emotional Health Collaborative, how our organizations and partner organizations in the state working to provide those services. So we're happy to share more information about those programs to be able to connect you with organizations that are doing and providing those culturally specific services as well.
Thank you both for that answer. Okay, let's see. And again, feel free to raise your hand if you have questions or drop them in the chat. Now that we have Andrea and Laura here, take advantage, please. I know that sometimes it's hard to get to emails, but we have them live, so definitely invite you to ask those questions. And I think I already asked this question to all the other panelists, the SOAM presenters, but and I think you already went a little bit over it, but what can community organizations or just community members continue to do to advocate for that funding, right? I know you mentioned that the funding this session, and the next sessions, right? Who knows what's going to happen, but what can we do as community organizations or community members to support this effort?
Let me pick a few. No, one of the main ways I think that we can be engaged with each other is to participate in each other's events, to be able to, follow our social media and come to our events, ask us questions about clarities on these policies that we're bringing forth or that we're working on. I think just maintaining communication, active communication with each other is the biggest piece. You know, we are working to grow our collaboratives, grow our coalition right now. So actively looking for folks who are centered or working within the behavioral mental health careers to participate in our Latino Emotional Health Collaborative, where they are actively working to be able to push forward, you know, policy and to advocate for different work being done. And we're also going to be, there's a lot of stuff in the works. So as much as y'all are connected with us and engaged with us, that's going to be what is going to, I think, drive forward the initiatives and the efforts that we are trying to push through in 2025 and beyond. So as much as we can stay in contact, I think I'm repeating myself now, but as much as we can stay in contact with each other is really going to be the big thing. So send me your emails, email me and Laura and our team, and we'll stay connected with each other to be able to see how we can show up.
Definitely. Thank you. I do see some questions in the chat. So how are you working with CCOs in improving their culturally specific care, especially around language access and adjusted appointment times to accommodate appropriate interpretation?
Yeah, I can speak on this one a little bit more. So one of the CCOs we've been working with a lot recently has been HealthShare, and they've been doing these collaborative meetings with a lot of the partners that they've provided funding for the Healthier Oregon program or OHP assisting. And we've been having a lot of conversations. So just know that all the community partners that are part of these conversations are mentioning the same issues that they're seeing with their community. So interpretation and culturally specific care seems to be something that these CCOs are still, working through, and a lot of improvement is still needed. And so just know that we're having these conversations with CCOs constantly. I know I've been with HealthShare, I believe I've been part of 3 or 4 kind of like feedback collaboratives that they hold with partners. And they're very responsive, and we even had community charlas with some Latina community members, I want to say last spring, and HealthShare provided their own like education pieces in Spanish with a representative that fully spoke Spanish and used popular education methods to like engage the community and make sure these members were engaged. And so I think HealthShare definitely, they want to improve, and they're holding all these spaces for us to provide feedback. And so we're just, waiting to see what types of, things they implement in with, their different plans, just because HealthShare has so many different plans that they manage. And so to make sure that all of these providers are, providing adequate interpretation and things like that, I could see could be a challenge, but they're definitely working on it. And that's good to see that they're hearing us and enacting their own, initiatives. And so let me see, I think I saw another question in there. Let me see. The unhoused community members. So through OHP, there's these flexible services that OHP members can receive, and this includes Healthier Oregon members, because Healthier Oregon members are OHP members. And we recently met with an OHA strategist, and they're really trying to push for HOP members are OHP members. So just making sure that people understand that they are receiving the same benefits, and they can access these flexible services where they can request housing. It's not guaranteed as of now. I know that with the new HRSN benefits, so health-related social needs that are being implemented, I believe in November for housing, will be mandated across CCOs that are working with certain CBOs. So I know that's definitely has been in the works for a while. And it's good to see that these OHP members, Healthier Oregon members, will be able to access these. So that's what I can say about that. And then let me see if I think there's another one in there. Oh yeah, the Medicaid waiver, they already touched on that. Okay. Yeah, I guess that's all I can say about those questions. And if you have any more, feel free to email us.
Thank you so much, Laura and Andrea, for answering those questions. And as I stated earlier, I will be sharing their contact information and any resources I will share throughout all the presentations. But at this time, I'm going to ask all of our presenters to please come back. And I know we don't have Devin in the room anymore, but if there are just any additional questions that you thought of as we were hearing these presentations, please feel free to raise your hand or come with me and ask them or drop them in the chat. And just as a reminder, we still have Mika here for who talked about the rec bill. We also have Samantha who talked about the early compassion and medical release bill. And we have Andrea and Laura who just covered Healthier Oregon as well. And thank you everybody who has been active in the chat. I know it's hard to keep up when presentations are definitely happening, but we really appreciate you being active and being here with us today. Yeah, everybody says, folks are saying thank you in the chat for the information. All right, I'm going to make space just for all of the presenters to see if there's anything else that you would like to add or any asks that you might have. I know we already went through some of them, but just, yeah, I'll just give you some space. We still have some time. So definitely want to make sure if you want to, if you want to just say any last words before we wrap up today, and maybe that will also allow for some questions to come in, but if they don't worry, I will send them to you, I will email them, and I will connect with the participants as well. So I'll start in order. So I'll hand it over to Mika, see if there's anything that you would like to, your parting words of wisdom, if you will.
Ooh, not to put me on the spot or anything, but no, I just want to thank all of you for being here. And it's just listening to the last presentation, I really appreciate it. It's a great reminder that, in order to move justice forward, we all have to work together. And that's really the only way that we're going to keep moving the dial and making this place a better state for us all to live in, more equitable and just. So yeah, just appreciate you all and hope we can all stay in touch, and please feel free to reach out.
Thank you, Mika. All right, we'll go with Samantha.
Yeah, thank you all again for taking the time to be here and listen to all of our presentations. Also, thank you to the fellow panelists. Those are like super informative presentations, and thank you to OHE. Again, if you want to reach out or are interested in doing some work around early compassionate medical release, my email is just samantha@oregonpsr.org. Yeah, that's all. Thank you, Daisy.
Thank you. All right, and I'll hand it over to Laura and Andrea to close us off. And before you all leave, I do have a feedback form that I would like to share with all the participants, so we can get some feedback and continue to be better in these events. But I'll hand it over to whoever wants to go, Andrea or Laura. I'll leave it up to you all.
Thank you. Yeah, I mean, I guess I'll close with just a reminder that, these initiatives take years to develop. This is an ongoing process that is going to require active engagement, active communication, active advocacy, right? And, we're specifically talking about Healthier Oregon, which is just focusing on Oregon's free public health access, right? So if we look on a broader scale, the West Coast is really leading the initiative on free healthcare for all. And to be able to take a look, and that's not to say that efforts aren't happening federally, but it's taken some time, right? So we're just seeing information about how DACA recipients are being eligible for Medicaid, right? I'll put a link in the chat on that information, but like these initiatives are slow reaching nationally, and we're really leading this locally. So to be able to understand that it's going to take all of us continuing to work together, engage together, to learn together, to share together, to be able to really push this forward. It's really key to the success of these programs. So I appreciate y'all taking the time to be here. For those who couldn't be here, I appreciate them watching, learning, engaging afterwards, and just, stay connected. Follow us on Instagram, all these good things. So thank you all.
I'll kick it over to you, Laura.
The only thing I would add to Andrea is encourage families to use these benefits to apply to Oregon Health Plan. The worst thing that could happen is they get denied, because the more these benefits are, this funding is there, use it, and just know that if you get these services, we'll be here, to help as our sister team. But I think in that way, it kind of shows community needs these benefits, and we want to be included, and we want to be part of that expansion of the OHP Bridge program. So that would be the only thing I would add to Andrea's comments, but encourage community to apply and, refer them to us if that's what they need or they're in our area, or if not, we can also refer out to other organizations. So yeah.
Thank you so much. Well, thank you so much, everybody. Before we go, I do want to take a minute to thank our captioner who has been supporting us in this event, as well as our interpreters, our tech support, and everybody in the chat, the rest of our OHEI team. And of course, all the panelists and participants for being here. We really appreciate the information. We know that things happen every legislative session, and so we're very excited to have you all in the room to share what's going on, where are they at, and definitely looking forward to also bringing this event. We do have this event in Spanish today, later at 2. So if you had any folks who couldn't be here today, make sure to let them know. If somebody could help me with dropping the registration link here in the chat for the Spanish one, please, that would be super helpful. But I know you all also have access to all of our social media and our emails as well. So I know folks have already said this, but let's stay connected. And as folks have already said too, we can't do this work alone. We all have to do it together in partnership with our community members and ensure that we're centering them whenever we are doing policy work, because without them, we can't do the work. So just want to take a moment to say thank you to everybody for being here. I see the registration link for the Spanish event starts at 2 today. And then also feedback form, if you could take a minute to fill that out and just help us improve these events, that'd be super helpful. But we are at time. And once again, thank you everybody for being here. We will see you next time. Thank you, everybody. Take care.
Thanks, everybody. Bye. Thank you.